to breastfeed, lots of things that are great about breastfeeding. I think the ones that I think are probably the most important that I talk to folks about, one is it helps the baby's immune system. So moms have antibodies in their body, in their blood, that help fight infections from all of the infections that they've encountered in their life, and so they have antibodies that help fight infections, and they pass those to the baby through the breast milk, so that the baby then has those antibodies in their system, and that really helps the baby fight off infections during the early months when the baby's own immune system is still developing. Another is that breastfeeding seems to reduce the risk of being overweight and obese later on in life. So that's another important benefit. And then probably I think the most important thing is that breastfeeding really helps support bonding between the mom and the infant. And the back and forth interactions that the mom and infant have with the breastfeeding, where the baby is latching and the mom is responding, or the mom is talking to the baby during breastfeeding, looking at the baby during breastfeeding, when their gaze meets and their eyes meet, those back and forth interactions that the baby and the mom have really are important for brain development.
Now with COVID-19, what have you heard from women who are nursing their baby? What kind of questions have you been asked?
I think people are worried about keeping the baby safe, and definitely don't want to accidentally pass COVID-19 onto their baby. Breastfeeding is still very important, and we definitely recommend that women continue to breastfeed, that moms continue to breastfeed. So, I think that, the main things are the common stuff that we're talking about with everybody, but especially when we're breastfeeding, hand washing, before and after breastfeeding, and certainly if the mom has COVID-19, we want to make sure that they're wearing a mask when they're breastfeeding to reduce the risk of exposing the baby.
Yes, and the women that I've interviewed so far said that here they find great support, breastfeeding support, People's Community Clinic. So what are we doing to help our providers to continue supporting breastfeeding?
So, I think there's a number of things that, we really try to promote with providers to talk about breastfeeding and the importance of breastfeeding during the prenatal period, starting in the prenatal period, during prenatal care, as well as on the pediatric side after the baby's born when they come to us. I think probably one of the main things is having lactation consultant, our awesome lactation consultant, to be able to help and support moms in their efforts to breastfeed, being able to get hands-on support if they're here in the clinic or a phone call to check on them and help them, I think is really helpful. And then and of course also you help them get breast pumps when they need breast pumps.
Do you have any words, anything you would like to say about World Breastfeeding Week?
Yeah, definitely. I think there's so many reasons why it's important to breastfeed, and it's such a wonderful thing that a mom can do with the infant and with the baby. Helps so much with bonding and the immune system and the general health and nutrition, like we talked about. But also, I think the thing I'd say, in terms of Breastfeeding Week, is that it's not just about the mom, and that there's stuff that all of us can do. So certainly on the healthcare side, there's things that we need to do to support breastfeeding. Businesses, employers can help provide comfortable places for breastfeeding for moms to be able to breastfeed or pump, so that they're able to provide milk to their infant. And then within the family, there's a lot that people can do. So dads can support moms in breastfeeding. It's not always easy, and there are challenges sometimes with breastfeeding. Sometimes it comes very easily and there's no issues, but sometimes it's harder. And so having the fathers who are supportive,
Right.
having grandmas who are supportive, having friends who are supportive is really important too. And then in the community, I think having people be able to be comfortable breastfeeding and having places for people to breastfeed or pump when they need a space for that is important. But generally, there's stuff that we can do at all levels of the community and
Yeah,
workplace
sure.
to support women in breastfeeding.
You're sure right.